So and then finally you saw me. It's 2 years ago, right?
Yeah.
And then we tried some musculoskeletal treatments, also with dry needling, and that is for the trigger points, and then you also tried those antidepressants as well, and then it's just partially relieved the problem, and the problem's still there.
Yes,
And then,
yes.
And then it's about half year ago.
Yeah, well, we tried to find a solution because, well, because the pain lasts too long, so I tried internet and whatsoever for any other treatment that possible.
And then finally we get to the prolotherapy.
Yeah, we get to the prolotherapy.
Yeah, the prolotherapy, initially I use the dextrose solution. The prolotherapy comparing with other treatments.
Well, for the needles, like you can release or relax your muscles for a short period of time. I would say 1 to 2 days. And because
so for the dry needling.
Yeah, for the dry needling, and then it come back. And for dry needling, you can't do a lot of positions at the same time.
No. Yeah.
Yeah, because it's involved like from my head, down to the toes, like the whole body. So it helps, but other muscle is still very tight.
Yes.
And also in a sort of tension positioning.
Yes.
And it's affect the muscle very quickly come back. But pull is the time is last long, and you can feel that the muscles relax or release, and then it won't come back.
I see. So it's immediately after injection, or is how do you feel? I mean,
well,
for the prolo?
I would say at the beginning it's quite scary. That I heard like you need to inject quite a lot of different parts.
Yes.
Which is, I think everyone will feel scary.
Absolutely.
But when I try it, it doesn't feel as pain as I thought. Because I know that I need to inject a lot of different positions, so I want to be awake when I inject, so I know what's happening, and then I can tell Dr. Lam, how I feel at the same time.
Yes.
But it's not as pain as the dry needle, I would say.
Oh, really?
Yeah.
So it's less painful than dry needle and acupuncture?
Acupuncture, I would say quite same.
Okay.
Because they didn't go into that deep.
Okay.
So, but when you inject the polo, then you will feel a bit sore, your muscles, and it's not as pain as I thought.
I see.
It's completely is not that pain at all.
I see. That's good.
So when you feel a bit sore, and then you will sort of feel the muscle is moving. I don't know how to say it, this type of moving.
Okay.
And then when they move, it's sort of release your pain a little bit, but it's in a very short period of time.
Okay, so it start working very shortly after injection.
Yes, so it's like when you inject like few seconds, you will feel the reactions.
I see.
And then for a few minutes or 10 minutes to 20 minutes, you can feel the muscles, the whole muscles really relaxing. And then for the very first time that I inject my shoulder, only take, I think after the whole thing injections is like 30 minutes to an hour. My whole shoulder muscles feel relaxed, and the bone actually go to the right positions.
Going back to the right position.
Going back to the right position. Why I can say it's the right position is I never feel that release.
Okay.
And it's not only release my shoulder, but my neck, I feel less pain. And the best improvement is my lower back. I didn't inject any for my lower back.
I didn't inject
it's
the lower
just
back.
my shoulder, and then I
neck.
can feel that my lower back is like doing 10 years of exercise, like it's very sore and exhausted.
I see.
So, and my lower back muscles feel relaxed as well.
I see.
And
how about the toes?
And my feet feel more comfortable than before. So, that's why I can ensure that my shoulder is in the right position.
I see. That's good. That's good. And then okay, so it's after we have done 4 prolos for your neck and then your TM joints,
Yeah.
and then
Our
head, and then the temporal bone, and also the zygomatic bones, and the shoulders as well. So today we're going to have the fifth prolotherapy. So let's go.
Okay, sure.
Okay.